Roles and responsibilities of healthcare professionals in community and public health. Good morning and thank you for coming. Public health is essential to the health and well-being of a community. No matter the size of its population, public health aims to promote healthy living, prevent diseases, and conduct health-based education to the public. In order to fully understand the roles and responsibilities of community and public health, it is necessary to look at the shared responsibilities within a community, understand the structure of the public health system, examine the ethical and legal obligations of health services, analyze funding sources, and discuss the importance of communication in public and community health programs. The health of a community is not left solely to the responsibility of one organization to fulfill. The health of a community is ultimately the responsibility of all members, to include healthcare providers, public health agencies, healthcare organizations, community-based organizations, government, and even schools. This responsibility becomes a collaboration of sharing. Communities must become actively engaged in their health. Being able to actively involve citizens from all levels of life, including leadership, plays a valuable role in the health of the public. These roles of leadership and advocacy are the compelling drivers of policy and decision change. These changes further healthy lifestyles and promote disease prevention to the public. No longer does public and community health alone share the burden of health promotion. Collaboration between those in the community, medical facilities, and health departments are increasing their guidance by working to decrease health detriments and barriers to the well-being of their citizens. This partnership is evident by the community benefit outlined by the Affordable Care Act. Hospitals and local health departments are both responsible for completing health assessments and developing improvement plans for change within their community. The foundation of public health is assessment, and with both entities working together, resources and experiences play a valuable function in the positive health of a community. Public and community health is initiated from federal, state, and local levels. These levels work together to provide the three core functions of assessment, policy development, and assurance, plus the 10 essential services of public health to monitor, diagnose, inform, mobilize, develop policies, enforce laws, link people to health services, assure, evaluate, and research. The main leadership of public health is provided at the state level. States determine which levels of government programs and services will be provided to their communities and determine the means in which funding will be granted. Although federal policies and regulations directly influence each state, the varied needs of the public are the determiners that guide decisions at the state level. The relationship of public health from the state and local levels occurs in three different ways. 29 states participate in a decentralized system in which public health from the local level is independent from the state. 6 states participate in a centralized system in which the state mandates direction of the local level, and 13 states are hybrid. Hybrids are a combination of both, in which larger cities act independently of the state, and those smaller jurisdictions without local public health guidance are directed from the same state level. Community and public health faces many challenges due to the complicated mix of health concerns and stakeholders involved with the well-being of a community. Principles and values sometimes collide with policies and regulations, leading to ethical dilemmas. Public health addresses ethical concerns with 3 principles: identifying the ethical dilemma, analyzing the actions and consequences of the situation, and finally resolving the dilemma. This dimension of public health means public health ethics seeks to understand and clarify principles and values which guide public health actions. Public health laws were created to preserve the rights of health care throughout diverse populations. These laws are structured and enacted from the federal and state levels and include individual state constitutions, regulations, rules, and statutes. Public health laws are needed in order to establish guidelines and overall protect the health of those throughout communities. One popular example of public law dictating the actions of the public is through the mandatory quarantines that took place in this country with the smallpox epidemic. This intervention worked to decrease the spread of this disease in the early years of this country, emphasizing the foundational need for public health law. Funding to each individual state does not occur equally, with some states receiving federal funding and some states going without. Federal disbursement is a combination of population-based and outgoing grant money determined by the needs of each state. Funding for community and public health also comes from the Centers for Disease and Control, Health Resources and Services Administration, and the state public health budget. One such program, the Hospital Preparedness Program, comes from the money granted by the Department of Health and Human Services, which helps healthcare facilities improve their ability to prepare and respond to public health emergencies. The Affordable Care Act also grants money through the Prevention and Public Health Fund. This money is filtered into the state and local health programs to promote the health and prevent the illness of members within the community. In order for public health to consistently meet needs, a steady and dependable means of funding must occur. Communication is a vital necessity in order for community and public health programs to successfully operate and fulfill their mission to the public. Multi-levels and disciplines are used to educate and reach the public through marketing strategies. Outstanding communication leads itself to improvement interventions in health and well-being, changes in negative health behaviors, and collaboration with multidisciplines in targeting social and physical improvements. When healthcare professionals are able to educate, influence, and motivate individuals into making positive health changes, the entire community is rewarded with a population focused on improving the overall health status and decreasing disease within their own communities. Thank you.